Setting up the recording now that we've gone through the introduction. All right, the topics that we're going to discuss today are some tips on panel for panel identification and monitoring. Then we'll go into clinical documentation, and that leads into monitoring for screening. So documenting so you can monitor the patient information, using practice search, flow sheet for chart review, and I also want to discuss before we close off at the end of the hour about connecting with other users. So some tips on panel identification. We know this is not just an objective or part of doing Alberta screening and prevention. It is the foundational activity for that, but it's also the objective for PCNs involved in the medical home and PCN evolution. A couple of things of strategies that I've seen with this that clinics are taking on specifically those transient patients. Every clinic has a transient patient population, even if you consider your patient population closed. A patient that may have been a patient at the clinic for 10, 20 years, moves away, comes back 10 years later. Often the clinic will see them for something if they're visiting. That's just an example, but every clinic really has transient patients. We know that there are clinics in Alberta with huge transient patient populations because workers may come through, but that really isn't their permanent place for patient care. Couple strategies in dealing with this. One interesting strategy that I saw a clinic take is they created a service provider in their clinic with the clinic's name, and they attach all transient patients to the clinic name as their service provider, and it's a way that they can easily identify which patients are transient. Now the other strategy is creating a patient status called transient or temporary, depending on what you want to call it, and they use that status for all transient patients. When you create a status, and if you're new to this, there is a help file in Wolf called Status Code Maintenance, and there are also some instructions on a tip sheet that you can download from the top website called Using Wolf for Panel Identification and Screening. You can create this status and you can make a new status active or inactive as you choose at the clinic. And that's an option that you do have. So you can create that patient status and attach all transient patients to that status in the EMR. When you do that, I don't know if you can see my cursor, you definitely want to date stamp the chart, and you do that by entering the dates here when you change a patient status, and then you save it when you're done. In a patient record, you will be able to see all the changes in patient status for a patient, the start date, the end date, and you're going to want to do that for practice search reasons as well, and have that on record for the patient. Okay, that's a quick tip there. Before we go on, are there any questions from participants on panel? Okay, and I don't see any on the screen, so we're going to move on to the next topic. And it's about clinical documentation of screening. So in your clinic, or if you're an improvement facilitator working with your clinic, definitely want to think about documenting screening information in an area where it can be tracked by your three great tools that are in Wolf. Those are practice search, rules, and flow sheets. And all three of them work the same in that they can track information that has been entered into what we would call a discrete data field, or it has information attached to it that allows it to be tracked. Generally, written text notes are the least ability to track those, and if screening documentation is recorded in that manner, it won't be easy to monitor by practice search or rules. Another important thing I wanted to point out is that staff without access to the physician work desk that are doing screening on behalf of the clinic have access to exam templates where they can enter patient information. This was a change last year, and some clinics aren't aware of it. So when a staff member enters F6 and they find themselves in the vital entry screen, of course they're very used to entering the vitals, but something they might not be aware of is that through this screen they have access to structured examinations. And at this point, using the drop-down menu, they can pull any structured examination that they need to use. And an example of one that they may choose to use, one that's shown here, is the top ASAP exam form. Or there's quite a few others that are in there that, depending on the screening that they're doing, here's the female GU exam. And the reason I'm pointing out the female GU exam is this is another exam template where you can monitor PAPs through practice search. So I wanted to make sure I point that out. Some clinics weren't aware that they could do this, and staff do not have to have access to the physician work desk to enter exam data that needs to be tracked. So thinking about this in Wolf, Wolf is built in a way that information needs to be entered in a certain area for it to be tracked. Height, weight, blood pressure have to go in the vitals entry area. Tobacco and alcohol in the personal history tab. Vaccine entry can only be tracked if they're entered as a vaccine, and you have to use the vaccines area there. Cardiovascular risk is assessed and recorded in the cardiovascular risk worksheet. The cardiovascular risk worksheet, when you hit print, whether or not you actually print a paper copy for the patient to take home, by hitting print, it creates a document for that patient that gets attached to the patient record and documents, and the document is called cardio risk profile, and it's easy to track. So that's a really important element. So, because some clinics have been doing cardio risk, but they haven't been hitting that print, and then the document doesn't get attached to the patient record. PAPs can be entered in preventative care or the female GU exam. Mammos can be entered in preventative care, but they are also stored in documents when they come back. We're going to talk a little bit more about documents. Colonoscopy and sigmoidoscopy get stored in documents when the results come back. You also have a referral record in the clinic. The labs get recorded in the lab requisition offers. The last one is exercise. And there isn't an easy and great place where exercise was meant to be recorded in Wolf. So the best place to put that in is a structured exam template. So considering all this, something that a clinic needs to think about if they're in an improvement project like ASAP is how do you record the offers, the declinations, deferrals in a way that you can monitor it. It's easy to record a lab requisition as an offer of screening, and when the results come back, that's very good evidence of the offer. But when the patient refuses it or defers it, you have to think a little bit outside the box of how you're going to enter it. So what you want to ideally use is a structured exam template. And recently, with access to a Wolf demo database, I created a structured exam template, and it contains something called smart tags, which will inform the patient visit. And I'm showing you a screenshot now. So I created a male and female version, and how to have access to it is when you open a SOAP note, you can pull up the exam template. I called it Preventative Screening Female. When this template is pulled up, it uses smart tags, which is a feature of Wolf, similar to kind of in the back end what's going on with practice search. to enter information in the soap note. And what it'll do is it can look for the last flu vaccine, when it'll validate if smoking has been verified. It'll look for the information in the cardiac risk worksheet and the lab information. What you can see on the screen, I know it's really small writing, but it's hemoglobin A1C, fasting glucose. It'll look for the last FOBT and FIT, as well as the date of the last PAP, as long as it was recorded in preventative care or the female GU exam. So what it will do is next, I'll show you. It will ask the user if they want to add the smoking history that's recorded for that patient, or at this time review it. If you hit no, it will allow the user to review it, and it automatically brings up the smoking and alcohol page. While there wasn't a smart tag for alcohol, at this point the user can validate the smoking and alcohol information and then click that it has been verified. That date stamps the chart, which is a good thing. And the next thing it's going to ask is if you want to bring in the information that's from the cardiac risk profile. And it gives a pop-up like this. You can click no to review it, or just add it as is to the patient chart. And the next thing, you're ready to start the exam. But this time, instead of having blank soap note, there is information in here that can inform the provider what has been done for this patient. So in this example, there's quite a bit that is none on record, because this patient hasn't had a lot of screening done, and it was a test patient. But you can see that there was a PAP performed. So if this patient was coming in, they'd know that quite a bit of screening is out of date, except for PAPs. And then you can go into the exam. What this template does is it automatically brings in the top female exam template with a number of drop-down menus. And in this screen, you can record information in the drop-downs about any offers, declinations, or deferrals or recommendations that you want to have associated with the preventative screening. I will bring you to another screen to show you in detail what some of them look like. So for example, because exercise doesn't have another great place to put it, you can put the exercise assessment here, and then you can record that you did it in the drop-down menu. And you can show, you can record a note in the text box beside it what that exercise assessment was. And there's places for all the different maneuvers associated with ASAP. Because if a patient refuses to have a colonoscopy, there is a difficult way, it's difficult to record that, but you definitely want to monitor it for ASAP. You'll see, for example, here, there's also been a drop-down menu for flu vaccine. Because for ASAP, even though it's out of season, let's say in the middle of the summer, and the patient's coming in for their physical, or they're coming in for a visit, and you want to capture them while you can, because they don't come in very often, and you want to have that chat about flu vaccine, you can recommend it and record that you recommended it, and you can record that you recommended it and the patient declined. So I'm just going to go back. So you can see what the exam template looks like. This is one strategy if you want to use it. I can make this exam template available to you. It's actually not that difficult to build if you're coached along. The thing that I want you to know is that these entry points here on the bottom can be customized. So if a clinic wants certain words in their drop-down menu, that can be customized at the clinic level and made available to all users in the clinic. So how can you get access to it? A couple ways. One, if you are already adept at importing and loading up shared exam templates. I can just email you the file and you can load it up yourself, and I have some instructions. If that is totally new to you, we can have a one-on-one session like we're doing right now on GoToMeeting, and I can help you load it up. So you can make that request directly to me, or you can request it through your improvement facilitator or your top clinical process advisor. So I've shown it to some clinics, and some like it, and some say they like to document how they're normally documenting and not use this, but that's it's available as a choice. Okay, before I move on, yeah, I see one request on the screen, so I'll send that to that user. Writing that down. And any questions about the exam template or documenting for Alberta Screening and Prevention? Okay, I am going to move on then. So, monitoring of data. So as long as the clinic is entering in data fields that can be tracked through rules, practice search, or flow sheets, we have some options at the clinic. So most clinics are familiar with rules, and here's a screenshot where you can see the rules of an individual patient. The icon shows up in the smart menu for the patient, and all you have to do is click on that icon and all the rules for the patient would show up. In this case, this patient happens to be Mrs. Elaine Anderson. Something that I've found when I'm visiting clinics is that you also can use your rule matches screen. The value of this screen is, it looks like this in your Wolf EMR. When you click on the rule matches, you can filter this in a number of ways, and some clinics aren't familiar with using the various filters. So in the filter area here, you can pull down the drop-down menu and filter by service provider. So if a clinic is divided into pods and an MOA works with just one doctor, they can use this to pull up the rules for a single service provider. They have to click Show All Rules, make sure that's clicked off, and they can look ahead and see all the rules that are showing up. This can be a very valuable tool because you could do this at the end of the day and see which patients are coming in the next day that have active rules. And for example, if a clinic were preparing their equipment for PAPS the next day, they would have an idea of how many patients are coming in the next day and require PAPS. So it's a really nice view. Some clinics aren't used to doing this. It's also a really nice opportunity. You could do it at the beginning of the day. You can have a huddle around the monitor. You're planning your preventative screening for the day while you're doing your PDSA cycles for Alberta Screening and Prevention, and you can plan your day and see how many patients are coming in with overdue rules. One thing I will mention is you cannot print this, and I asked Wolf about that it's not printable, but you would be able to look at it on the screen. Any question about this rules view? Now, the third way, so rules at the individual patient level are a great way of monitoring patients overdue for preventative screening. The rule matches view is another great way to monitor which patients are overdue for screening. A third way is flow sheets. Flow sheets are a tool within Wolf. It's like a spreadsheet that mines like a practice search through the patient data to present the requested patient data over time. There are a number of pre-designed flow sheets within Wolf. It's accessible on your right mouse menu. This is an example of the diabetes CDM flow sheet, but it shows the patient data over time. What you can do as well is you can create a customized flow sheet containing all of the information that is used for Alberta screening and prevention. Now, your flow sheet can be customized, and it can be customized at the clinic level to pull where providers in your clinic are documenting. So, for example, if you have some lab data and you are looking at PAPs in multiple ways by the PAP result coming in as a investigation result. Some people in the clinic are entering PAPs in the preventative care area or the female GU exam. You can set the flow sheet to look in both areas. And it makes it a very useful tool for monitoring that patient. So as the patient's coming in, the person doing the preventative screening would pull up the flow sheet, and then they can monitor the maneuvers that are overdue for the patient. If you add the flow sheet as a monitored flow sheet, you can see up in the left-hand corner here that if you click add and add it as a monitored flow sheet, it will pop up automatically when you open the flow sheet for that patient, which is a nice feature. And it can reduce the workflow by one click. But it's a great way for monitoring. Something I wanted to point out for clinics that are doing the chart reviews is the flow sheet, even if the flow sheets are not used to monitor patient care during patient visits, they are a fantastic tool to reduce the time required to do your chart review. And if it would take 30 minutes to build a flow sheet that would pull all the parameters that you're looking at for the ASAP chart review. And then if you opened it up for every patient that you're doing the chart review on and only looking elsewhere in the chart for missing information, it would make your chart review very fast. So I'm recommending it as a technique for that, even if it's not used for patient care during the patient visit. Okay, there's a couple examples. So some tips on using flow sheets. Wolf has a help file called CDM Flow Sheets. There is also a tip sheet on the top website called How to Customize Exam Template and Flow Sheet, which shows how to build a flow sheet based on an exam template that's been available on the top website, although I've improved that, and there's another one available now. And it's a great technique for screening, but also if you're doing chronic disease management in the future, it's a wonderful tool for that. So questions come in is how do you find that screen? I'll go back. So how do you get to the flow sheet screen? So there's a number of ways to get there, but a really simple one is when you're in the patient chart, right mouse click, and flow sheets is one of the menu items in your right mouse click menu. If you have customized your right mouse click menu and you do not see flow sheets because you might have made a very tight right mouse click menu, you have to go back to your preferences and you can add it to your right mouse click menu or add it back so that you will see flow sheets for that patient. And it's again, really nice tool. Okay, before we move on, any questions about flow sheets? Okay, great, we'll move on. Okay, I want to mention it here, document keywords. Document keywords are a parameter that is searchable by practice search rules, and flow sheets. So at the clinic level, your document keywords ideally are consistent and accurate. For ASAP, there are two maneuvers where they're critical, and that's mammogram and colonoscopy, and sigmoidoscopy too as well. There are fewer clinics doing sigmoidoscopies in Alberta. I have been in clinics where literally there are over 100 keywords used for mammogram. And there's misspellings, there's left, there's light, mammography, many ways that clinics use it. It's really important for clinics to start looking at their document keywords and how their practices in the clinic will influence their ability to do patient care on a proactive basis. Because document keywords are searchable, it means that you can activate rules for anything associated with a keyword. You can also set up a flow sheet. When staff that enter the document keywords free type, they will make mistakes, or they will free type, and they might be thinking that they are entering a very accurate description of what the document is. But the more variability there is in the clinic on a document keyword, it reduces your ability to search. So ideally, clinics should think about document keyword maintenance, cleaning up their document keywords. There's no free typing, and staff only use the keywords that are in the drop-down menu. To help this, you can put a list of keywords at each workstation. It's sometimes hard for clinics to understand because they think it's faster to free type. But what consistent document keywords enable a clinic to do is to move from individual patient care to population care. And that's something that you can do when you can start using rules. Rules are very difficult to use for mammograms and colonoscopy when you have tens or hundreds of versions of descriptions attached to mammogram and colonoscopy results. So that's why it's a very important task. I also, if anybody wants it, I have a real list of document keywords for a clinic. In 3 columns, they fit on a single piece of paper, and this clinic has no free typing. It has to be policy that there's no free typing because the EMR will not prevent somebody from free typing in. So it has to be a policy at the clinic that there is no free typing. Any questions about document keywords before we move on? If anybody wants that list of the document keywords, and I have your name that you requested it, I will be happy to send it to you right after the webinar. I'm writing that down. All right, move on from document keywords. Okay, so this relates, I just wanted to show you something in document keywords. So here's a real screen of some document keywords. And something that can facilitate this change at the clinic level is the fact that you can use 3 keywords, you know that, in your EMR. So if for some reason a clinician wants a description like right or left can be a separate keyword. So for example, looking at the screen, instead of this being X-ray, it said mammogram, and if it was only taking place on the right, then right would be a separate keyword. You'd never use the description right mammogram because you want one keyword for mammogram. The other thing that everybody should know in the clinic, the notes field when you are looking at documents is the area where you can do some free typing as well. So that brings us into our last topic, which is practice search in Wolf. If you're new to practice search, I want to recommend the Wolf help files associated with practice search. If you use these terms in your Wolf EMR help, practice search parameter, practice search, Wolf predefined practice search rules, or you can also get to the video tutorials. There's 3 video tutorials that I'd recommend: the practice search exam findings, practice search separate observed dates for labs or documents, and how to use bulk add in practice search. On top of the Wolf help files, we have a tip sheet on the top website called Wolf for Panel Identification and Screening that can be very supportive for clinics that are new to practice search. So just thinking to begin with on how to use practice search. So when you are doing practice search, the demographic parameters are part of the parameters that you're going to build your searches on. So how your clinic decides to do panel and use the status field are going to be important when you are using practice search. For example, on this screen, this practice search shows how to do a practice search on a specific status. So this was an example I created where, let's say a physician has a group of patients that they're all the members from the Calgary Flames happen to be this physician's patients. So they create a separate status because they're going to have individual rules for these patients that are going to be different from the rest of the population because they treat them differently. For example, let's say their goal is to weigh these patients every 4 months because they're performing athletes. And so they are doing a search, and here's a search example of patients that have had no weight on record in the last 4 months. And you can create the search by status if you're using that as one of the parameters for your panel identification. You can also, because you can see here, patient data verified is one of the practice search parameters. If you are new to panel identification, you're at the beginning of the process, you're doing setting up panel identification processes in the clinic, and clicking off that patient data verified is an important process at patient check-in, and you want to do a quality improvement check. So while you are in the panel stage, or periodically, maybe you have some new staff members and you want to make sure they're remembering to click that patient data verified at check-in. You can do a practice search using the criteria of the visit dates and see how many patients have had or have not had their patient verified in a period of time. It's a nice little improvement check, and then you can bring the results to your improvement meeting. Oops, there we go. So if you are new to practice search, some things that you'll want to be aware of. You get to practice search from your home screen, and the practice search screen comes up. You're going to click the piece of paper to start a new practice search. If for some reason you wanted to see all of the practice searches that are on file in your EMR, they can be accessed by clicking the file folder icon, and you'll see all the predefined practice searches that are built by Wolf or any that any individuals in your clinic may have created. And here's a very simple practice search that would be useful for Alberta Screening and Prevention, and these are screening for patients with no height on records for adults. So when you create the practice search, you first of all have to set the demographic data. Here it's between 18 and 79, and you are excluding patients that have a height on record. It's important to click off search all patients if you are not a clinician. Clinicians don't have to click this off. And then you can show your search results by clicking on this button here. If you wanted to save this practice search and create a rule in your clinic to look for patients that have no height on record, you need to save it as a rule. When you do that, it brings you to this screen. We'll go back. And this is the icon to save it as a rule, where you see the ruler. And it brings you to this screen. And when you create your new rule based on your practice search, you're going to give it a name. And this is the name here, the search name that is going to be stored in the search list. So it matches with this list here. If you're saving it as a rule, so it's going to show up in the patient records, you want the text to be relevant to somebody who is working in the clinic to identify what that rule is and what needs to be done. So in this case, there's no height on record. You can set the priority of rules in your clinic, and that's something that you can filter on. When I showed you earlier the filter screen, 5 is the default and what most clinics use. You're going to click this button when you want to activate a rule. That means it's going to be combing through your clinic records every night for the next day to look for active rules. And then you do have to save it as a new rule. Before I move on, are there any questions about rules? Oops. Okay, we're going to move on then. Thank you. So if you are new to practice search, I want to encourage you to go in and use the practice search in your EMR. No harm can be done just by doing searches. And if you're new to it, you're going to need to do some many searches and get some practice with it. You can't break anything, but something I want you to be wary of, depending on the size of your database. And what I mean by that are how many patients are in your clinic. So there's 2 things that will determine the size of your database. One is the number of patients and how long you've been on Wolf. If you've been on Wolf for a long time, you will have quite a bit of data that the system has to search through. And if you have the larger the size of the clinic or the larger number of patients, the greater the size of your database. And it can take a long time if you create a very open search. So for example, if you had 10 doctors in the clinic and you've been on Wolf for 5 years and you just wanted to create a list of all the patients in the clinic, it would take a little while to do that. If you just wanted to create a list of patients that belong to one doctor, that search would be shorter to conduct. If you wanted one doctor's patients between the ages of 18 and 25, that search would be even tighter. So while you're practicing, if you're working in the clinic and it's the working day, you might want to keep it tight so you don't end up with a search that's going to take 5 or 10 minutes to pull up, because it's very, very big search. So you want to make it smaller and maybe start by searching with just the patients that belong to one doctor and create the parameters to be small. Once you've had some practice with practice search, you definitely have to validate it. So whenever the list comes up, validate and say, is this list producing what I think it should be producing? Click on the records to make sure it's got the data that you selected in the practice search. Take your time to practice. You'll be surprised at the information that you might find. When your clinic is ready to move on to rules and start using rules if they haven't used it for the first time, is start with one rule and do a PDSA cycle, and then add them incrementally. Currently, if your clinic is using rules and you have an improvement meeting and somebody says, well, we're not using them. We've got all these rules popping up, but nobody uses them. Have that discussion with all providers. If nobody is using the rules, you can deactivate them by going back here. If you go back to your rule, I'm going to show you. If you go back to your rule in your clinic, you can turn a rule from active to inactive by clicking on this button. And if the rules aren't being used, I suggest that you go back, have an improvement meeting, say why are we using the rules or not using the rules, have that discussion, decide which rules in the clinic need to be active, and if anybody created that rule and you can see who created the rule in your clinic, that person needs to be involved. Some clinics I've been in, they've got rules, and the rule was created by a provider that left the clinic a couple years ago, but nobody turned the rule off. So everybody just ignores the rules. It's rules were designed in Wolf to be there. You have to click on them. It's they're not meant to flash in your face, and that was a decision based on user feedback when they were developing rules. So it's not a good habit to ignore rules. If you have rules, don't ignore them. If everybody's ignoring them, turn them off and start again and do a PDSA cycle because they are an excellent tool. Okay. And that was the main content that I had for now. So before we move on from rules, any questions about rules? Okay, one question came up. What is a PDSA? A PDSA is a plan, do, study, act cycle, and it is part of a quality improvement project cycle where a team will plan a change, they study the change, actually they plan the change, they do the change, they study it, and then they will react and act on the change depending on if it was positive, neutral, or negative, and use it to inform the improvement that's taking place at the clinic. Any other questions about rules? You can type them in or ask them on the audio. Okay. Before we finish off today, go back to the last screen. Something I did want to mention is that networking and learning from other users. It's a really important topic, and you have a number of ways that you can do that. One, at the PCN level, it's recommended to start user groups and integrating with other users of the same EMR, and we know that Wolf is the most popular EMR in Alberta, so there's great opportunity to network with other users in your PCN. There's also the Wolf user group meeting that takes place with Wolf, and it's scheduled already in the fall. I think it's in November, and that you can see on your Wolf splash page. The other thing that you can do is network with other users on the Wolf community portal. And I'd recommend users set up questions there because we have so many clinics in Alberta involved in panel and preventative care. It's an excellent place to pose a question and to get advice from other users across the province in your Wolf community portal. And then the last place as well is we would like to facilitate this at top. We can do it through our webinars, through the clinical process advisors, and the EMR page that we have set up on the website for ASAP clinics. So I'd like to recommend that as well. So this is a final time to ask your questions, and you can either pose them over the GoToMeeting control panel or ask them on the audio. Are there any questions that a user would like to pose to another user on the line today? If somebody's in another clinic that they would like to ask a question about their approach? Okay, well then I'm going to sign off and wish everybody a great day.
Thank you, Barbara.
You're welcome.